Yay! You made it back. Y'all, we're on episode 3 of 5 on this series where we are talking about menopause. And oh my gosh, do I have some information for you? All right, y'all. So, welcome back. My name is Connie. I am with Self Care University OK. I am your host. I am a women's wellness naturopathy practitioner. I am so glad you're here. I am so stoked because we are going to be talking menopause myths that are holding you back. And I sure hope you have your coffee, tea, cooling blanket, your fan, whatever it is, because y'all, we are going to be busting the top myths about menopause. Like, just get through it, or you're too young. I can't stand that. So, here we go. Knowledge is absolutely power when it comes to your hormones. You know what you're doing, you know what you're feeling, you know what you're going through, all the things, okay? So today we are going to be tackling a topic that can feel so confusing, so frustrating, and sometimes downright scary for many women. So, menopause myths. We've all heard some of these statements floating around where it's from well meaning friends, social media, or even our own internal dialogue. Okay, these are my air quotes. You're too young to be in menopause, or just tough it out. Everyone goes through it. Or hormone therapy is a dangerous. Avoid it at all cost. Or weight gain is inevitable. Just accept it. Oh my gosh, I cannot believe that some of these are actually things that have been heard, that have been said. I mean, obviously, they're written down for a reason because you all want me to get you the down and dirty information because this is what is going on in our world. This is the dialogue that some people are being fed. And like I said, if you're in your 20s, listen to this because sometimes these things are cyclical. Like they just come right back around, and you're literally going to be one step ahead of the game because you're already going to have just this information ready to go. Okay. So I want to invite you all to press pause on those outdated beliefs because every single one of them is holding you back from feeling empowered, informed, and in control of your own body. Now, I'm going to tell you this, a little disclaimer, okay? These episodes are not to diagnose, they're not here to treat you, they're not to become the newest thing that you should be doing if it is against what your practitioner has asked you to do. You have autonomy. You have the right to your own self care, health care. So just be mindful of that. But if you've got a provider that has you on a treatment track, then and you want to utilize some of this information and you want to have a chat or a convo, there you go. Okay. All right. So over the next 20 minutes, we're going to be identifying these common myths. We're going to be unpacking why they don't serve you. We're going to replace them with evidence based insight from me, an RN perspective. Okay. And we're going to be giving you some practical tips, some practical steps so that you can move forward with confidence. Okay. Remember, like we said in the last episode, putting you in the driver's seat. Okay. If you've ever felt, I'm talking dismissed, unheard, overwhelmed when talking about menopause, y'all, this episode is for you. Like I said, if you have not hit the subscribe button, if you haven't found some way to become besties with me so that you can get this information, go ahead and do it. And if you already know that you want to share this with a friend, family member, coworker, whatever it is, no one's going to be offended because this is information that I'm sharing that really should not be gatekept at all. So, y'all, from my lips to your ears, let's go. Okay. So let's cut through the confusion. We're going to debunk the myths and I'm going to help you feel like yourself again. Even better than yourself. Okay. Ready? Let's dive in. So let's go over myth number one. And if you're familiar with any of these, oh my gosh, make sure you put it in the comments. Okay. You're too young for menopause. Okay, so myth number one, you're too young for menopause. I hear this so often when working with women in their late 30s, their early 40s. They'll say, my friend at 52 just printed her FSH levels, her follicle stimulating hormone levels, and told me, girl, you're not there yet, so I'm fine. Here's the truth, okay? Perimenopause, okay, like we said in episode one, it's that transitional phase leading up to menopause that can start as early as your mid 30s, your late 30s. And that doesn't mean that you're going to drop into full menopause overnight. No way. But it does mean that your hormones can begin shifting much earlier than most people realize. So there you go. All right, consider this scenario. Who loves a good scenario? Okay. So you're 39 and you've been feeling tired for months. Your periods are suddenly heavier one cycle and then they're lighter the next. Your mood swings feel more volatile. You're like, who is this woman? And then your anxiety is through the roof. So what do you go to do? You go to Dr. Google and you say, am I too young for menopause? And then, whoa, you see a bunch of forums, like these posts that are saying, no way, don't worry. So then you shrug it off and you're like, yep, I'm just stressed out. Okay. But I'm just going to tell you, stress alone is not always the culprit. Okay. Because what if your progesterone is like starting to decline and then your estrogen is becoming unopposed, right? Like, oh my gosh. So that can cause estrogen dominance. That can lead to irregular periods. Let's talk migraines, mood swings. Let's just say, and more. Okay, we're just going to like leave it there. Okay, so from an RN perspective, I want you to understand that age is not the only factor. Genetics, stress, nutrition. Oh, what about those environmental toxins, right? Those can shift your hormones earlier, and I'm not even going to go over some of these skin cares and these soaps and lotions that I'm seeing, okay? So, tracking your menstrual cycle and symptoms is super vital. If you don't know when the last time you had a menstrual cycle was or the first day of your last menstrual cycle, ladies, get to tracking like we were talking about. Okay, so put it in your calendar. If your cycle length, like if it jumps from like 28 days to 24 days and it fluctuate, like I'm talking wildly, that is absolutely a big clue. Okay, labs can help. Labs can, like we said in the last episode, there's sometimes when your labs can be normal and then you're thinking in your head everything's fine, but your practitioner is like, yeah, but I want to keep an eye on it, and you think they're just being like overprotective. Just remember, your levels could be on in the normal side, but like trending towards the higher end or trending toward the lower end because there's something specifically or things specifically they want to watch for. Okay. So if you really suspect something is off, ask your provider to do like a test called the follicle stimulating hormone, like check your FSH, check your luteinizing hormones, which is your LH, check your estradiol levels, day 3 of your cycle. Like these are very specific. Okay, even if you're like even if they're normal It's literally like this informational guide for you. Like I said, your practitioner may find you on the closing in on the higher end or closing in on the lower end and wanting to watch those. You never know. You may even have your provider order you a Dutch test. Good luck to you if your insurance will cover that, but if not, I got you. Let's talk. All right. So next time someone tells you you're too young, remember you're not broken. Really, you're just likely transitioning, like I said, and it's okay to pay attention, and literally, it's okay to take action now instead of waiting until these things become, I mean, glaringly obvious, right? I mean, this really leads me to like myth number two, to just tough it out. Everyone goes through it. Oh my gosh, I can't stand that one. Okay. So just tough it out. Everybody goes through it. That's going to be our myth for sure. I get it. Nobody likes to complain. And I'm all for resilience. Okay. Like, let's go. Let's move on. Who has time for this? Okay. But when it comes to your hormones, toughing it out, that can leave you feeling exhausted, frustrated, and even dismissed, right? So imagine this, like we said last night, you're in a meeting and suddenly your face turns bright red. You break into a sweat and your heart is racing, right? And you try to maintain composure, but inside you are mortified. Later, you go home and your energy is zapped, gone, because you didn't get any quality sleep after being jolted awake, okay, by the night sweats. Am I speaking your language, right? Yes. So you chalk it up to being hashtag normal, quote unquote normal, or just one of those nights. But here's the problem. Normal doesn't have to feel debilitating, okay? If you wait until your symptoms are so intense that you just can't even function and you miss countless opportunities to intervene earlier, no, yeah, you missed it, okay? Let's go. Let's get in there. Let's tackle this, okay? So like from a clinical standpoint, there are evidence-based strategies that you can implement right now. I'm talking immediately. Okay. And these are going to be some things where you'll be like, oh my gosh, I totally can do that. I have that. I could do it. Let's go. And then sometimes you may go, okay, I've been looking for some retail therapy moments. So here we go. Here's the big one. Okay. Lifestyle adjustments. Okay. Cooling your environment at night, like fan, and if you've got one of those little diffusers that just really puts out this really cool mist, because you know you want to put this really good scent in your room, and it's lavender, and you just already love that. It's cool. Also, try changing your sheets to like a light cotton sheet. My super fave is bamboo. It is so, I love bamboo. It is moisture wicking. It is super great, breathable. I mean, I think it is, but there you go. So layered clothing during the day. And you're going to be like, what in the world did you just say? Yes. So just please listen to me, okay? So layered clothing during the day so that you can actually remove garments when you're starting to feel hot flash. Does anybody say garment anymore? So just know that if you're listening to this, just know what I'm talking about. Like if you want to wear like this, not strappy, but if you want to wear a really nice, short sleeve shirt underneath, and then you're wearing like a cardigan, there you go. Because it's something that you can take off the cardigan, and then you're wearing short sleeves, and then it's like, it's this instant cooling down moment that you're like, thank goodness, okay? Also, identifying stress management techniques that actually work for you. Does deep breathing work for you? Ooh, what about like that EFT tapping? I just did one of those the other day, and oh, that was so great. or I don't know. I kind of have been diving into this a little bit, but like meditation, but it doesn't have to be like this super long one, right? Like even like 5 minutes of meditation. Now, here's the thing that's probably going to get some of you, and just, you know what? Please just don't turn off the volume, okay? Just really hear me out because I'm really the one you want to listen to on this and really bring this information when you go to the grocery store, okay? We're going to need some nutrition tweaks, okay? You've probably already felt like you need to make some changes. I am not saying to go into the pantry and throw everything that is processed in the trash, okay? Because then you're just going to hate me forever, okay? That's not what I'm talking about. And I literally just said the word tweaks. So there you go. So now we're still friends, right? All right. So increasing your phytoestrogen, those type of foods like flaxseed, soy, lentils. Just be careful that if you are gluten intolerant, sometimes soy can have a little something funny in there in that soy milk. But I'm talking like, like the real stuff, like the stuff that, would come from nature. Okay. If you can tolerate those, do it. I mean, I feel like a broken record here, but really prioritizing protein. If you have never heard me talk about protein, I mean, like we must be under a rock because I talk about protein so much that protein is a big, large molecule. It is so great. It is like, it is your energy source. It is let's go. Yeah. I will not keep harping on the protein this episode, but you know what? You might hear it again. So let's talk about healthy fats. So at meals, those really do help you stabilize your blood sugar, which is going to be really really nice, so that you're not feeling like you're about to fall asleep midday. Okay. And then hydration, that's super key. I'm never going to stop talking about hydration, proper and appropriate hydration, because dehydration can actually worsen those hot flashes. Okay. So, nutraceutical support, like I said last time, I really find myself being like this supplement guru. Really, is someone who appreciates, as a naturopathic practitioner, I really appreciate the natural side. Like there's 70% of things that can actually be done naturally versus climbing right into the prescription bottle, unless that's something your provider asked you to do. Remember, I'm not practicing medicine here, but if you're wanting to have a good conversation with your provider, let's talk about things that we can ask the doc, the nurse practitioner, your provider, if we can try some things that are more on the natural side. And you know what? I've even heard that sometimes the natural supplements can take a little longer, well, or it can be a little bit less effective. Well, I've also heard it too, in the same vein, that some prescriptions are just a little heavy. And you find yourself having to take other prescriptions to counteract the effect that the first prescription gave you. So, let's not, we'll just all play nice. Let's talk about like magnesium for sleep quality and muscle relaxation, right? Or let's talk vitamin D to support mood and bone health. Wild, right? Vitamin D3 with the K2, it really helps put, unless you have like a clotting issue, then, talk to your provider about vitamin D3 with K2. But it really does help take that and take it from the muscle and put it right into the bone. So let's just give some praise to the vitamin D3. Let's do aptogenic herbs like ashwagandha. Those can really help modulate the stress responses. I also appreciate other things that ashwagandha is very well known for. And if you don't know those, let's chat, okay? Let's help Stella get her groove back, all right? So really, just toughing it out doesn't mean ignoring those tools, okay? It means using them, okay? So you don't have to be the hero, and you can really be strategic and compassionate towards yourself. Remember, I'm all about self-care, okay? So if someone tells you that you're being dramatic and that you'll be fine, okay? This is what you can say. I appreciate your concern, but I'm doing the best I can. That'll just really you know, just that'll really just kind of simmer it down. But to bring it even like a step further, you can say, I'm literally gathering information, I'm tracking my symptoms, and I'm taking steps to feel better. So this is about my health. I deserve support. Okay. That is super important, y'all. And we were just on myth 2. Okay. Let's talk about myth 3. Okay. Um, if you already have an oncologist, if you already have a primary care doc, and you already have someone who is talking to you about these, you know what? Ask them to listen to this part. Okay, ask them to just lend their ear to this moment while this RN decides to have a conversation. Let's talk about this myth number 3, that hormone therapy is dangerous. Avoid it at all cost. Okay, so if I had $1 for every time I heard someone say, I'll never take hormones, it's too risky. I'd be sipping herbal tea on the beach by now, right? I'm just going to tell you that I've heard it so much, okay? So here's what we need to clarify, that not all hormone therapy is created equally, okay? We've got these two types of hormones. We've got bioidentical hormones like estradiol, estriol, micronized progesterone. Okay, those are molecularly identical to what your body produces. Okay, and then we also have synthetic hormones like Premarin. Yeah, good luck getting that covered by insurance, right? Or medroxyprogesterone acetate. Okay, now those have different structures. Okay, so you know what? Give these some thought, right? So when the Women's Health Initiative study in 2002, they linked conjugated equine estrogens, okay, Premarin plus medroxyprogesterone acetate, to increased risks of breast cancer and clotting issues. Okay, it created fear that still echoes today. Okay, but that study involved here. Okay, I'm just give you 2 factors for that study. Okay, the first one: older women, average age were 63. Okay, who were years past menopause, not perimenopause. Okay, and here's 2 specific forms of hormones like conjugated equine estrogens, plus a synthetic progestin. So, when the bioidentical hormones are used thoughtfully at the right dose via the right route, like transdermal patches, creams, or low dose vaginal applications, okay, and monitored properly, the risks are significantly lower. Okay, in fact, there's data suggesting bioidentical hormone therapy can, listen, right, improve bone density and reduce fracture risk, reduce hot flashes and night sweats by 75 to 90% in most women. And also, oh, praise the Lord, here we go, improved mood, sleep, and overall quality of life. So, that doesn't mean that hormone replacement therapy, you also have seen it called HRT, okay? So that doesn't mean that HRT is automatic for everyone, okay? So as an RN, I always say, assess your personal risk factors, okay? Like family history of breast cancer, okay? Clotting disorders. What about liver disease, okay? Or what about explore non-hormonal options first? Like nutrition, botanicals, supplements, stress management. I'm going to tell you, those are my favorite, and I'll say it again. Explore non-hormonal options first, like nutrition, botanicals, supplements, and stress management. Okay, ask your doctor or book your appointment with me. Let's go ahead and see what we can look into for those if that's going to be something you want to look into first line. All right, so here's another one. If you're still having debilitating symptoms, right? Like consider a low dose bioidentical approach with close monitoring of like the labs like estradiol, progesterone, estriol, and the SHBG and DHEA. Make sure you really get those checked, okay? All right, so reassess regularly. You're going to want to work with your practitioner who checks your labs. I'm talking like every 3 to 6 months. And they're going to adjust things accordingly. Like I said, some of those labs may be a specific way and they want to look. Okay. So, really, by painting HRT with a broad brush of dangerous, we do a disservice, really, to women who could actually genuinely benefit from it. This is me shaking my fist over here, okay? So, seriously, if you are curious whether hormone therapy might be right for you, I strongly encourage you to book a consultation, um, seek information from your practitioner because there is a safer, evidence-based path forward. Okay, so y'all, let's go right on in to myth 4. We are right into the GLP-1 era. I mean, I don't know. I feel like we're, what, 5 years into everybody knowing about GLP-1s here. So let's just go ahead and talk about it because you're probably wanting to know. Okay. Here's myth number 4. Weight gain is inevitable. Just accept it. Okay. So if you're driving, don't do this, but raise your hand if you've ever said to yourself, I'm eating the same as I used to, but I still keep gaining weight. I hear this from my clients all the time. Okay. So if that's your hand up, okay, I want you to know that weight gain during perimenopause and menopause, it is common, but I'm just going to say it's not inevitable. Okay. If you're understanding why it's happening. Okay. Several factors contribute to shifting body composition, we'll say. I'm going to give you 4. Okay. Lower estrogen levels can change where your body stores fat. Okay. Often more around that stubborn abdomen area. Okay. 2. Reduced muscle mass, like that sarcopenia. I've talked about this so many times, and you're going to hear sarcopenia so many times, okay? So reduced muscle mass, sarcopenia, it typically begins in your 30s, and it accelerates in your 40s and your 50s. And really, if you're not actively countering it with resistance exercise, y'all, you hear me talk to y'all about going into your pantry and grabbing the can of beans that have the same size. Grab those 2 cans, put one in one hand, one in the other, and really just do a set of reps. And I go over that information with you all because, for one, you don't have to join a gym if you don't want to join a gym, because I think by now, are you still upholding your part of your gym membership and showing up? Have they called and asked if you're still alive? So there you go. If you're someone who prefers to do a home gym, there you go. So here's the third one. Slower metabolism. Okay. You burn fewer calories at rest than you did in your 20s. Okay. Here's the biggie. Here's number 4. Insulin resistance. Okay. It's often worsened by stress, poor sleep, and high sugar diets. I don't care if you are on the max dose of XYZ GLP-1. I don't care if it's natural GLP-1 or synthetic GLP-1. Your high sugar diets, I'm telling you, that can really bring that on. Okay. So here's the key. You don't have to resign yourself to like this size acceptance, right? if you have a really like a growth mindset around your body. Okay, so here's how we're going to do it: strength training at least 2 times per week. Give it a thought if that's something you and your provider have said that you've got the approval to do so. Lift weights or use resistant bands to build lean muscle, right? And then muscle burns more calories. Muscle burns more calories at rest. Ha! How fun is that, right? Let's get protein focused. Oh my gosh, there it is. I said it again. And like I said, this is not a regimen. I'm not putting you on a regimen. This is not a nurse's order. This is literally things that we're going to be talking about. Put that out to your provider. Put that in your notes for something that if you and I need to talk later, there you go. So for that protein focus, aim for about like 0.8 to 1 grams of protein per body, per pound of body weight each day. Okay. That can actually help with satiety and muscle maintenance. So satiety is actually that feeling of fullness. It's actually like the thing that everybody enjoys about those synthetic GLP-1s is that it actually helps them feel full. Well, this way it's actually natural. So the protein is actually giving you that satiety and it's giving you that muscle maintenance, that fuel that we need. All right, here's another one. Fiber-rich foods. Okay, so remember like a million years ago whenever we talked in that one episode about your bowels? Here we go. Okay, so if we talk about fiber-rich foods, please know that I'm also talking about having an adequate amount of hydration, okay, water consumption. So like fiber-rich foods, vegetables, legumes, oats. If you're someone who's heard like those stories about oats, you know what? If you want to do oats, do oats. If that's something you can't do, don't do it. Okay, find something else that's going to be full of fiber. Okay, what it really does is it stabilizes the blood sugar and it supports your gut health. You would be surprised at how nice fiber-rich foods can be to the microbiome of your gut. Okay, so also being mindful of stress management. That cortisol level, sneaky, right? The cortisol is that stress hormone, okay? And it really does encourage belly fat. I'm not saying that everybody who is obese is stressed out, okay? But all I'm saying is that for you, if you're noticing like a big expanse in your midsection, okay, what's our stress level like? What's the cortisol levels like? Did you have any of those labs checked, right? And some techniques like deep breathing, meditation, and really like getting that gentle amount of yoga in. That can totally matter, okay? And then what about that quality sleep? Remember when I was talking about the bamboo? Oh my gosh, I have this pair of bamboo pajamas. It's my super favorite. And I feel so comforted in those pajamas. They are so wonderful. Like they literally keep me cool in the summer and warmer in the winter. It's just phenomenal what bamboo fabric does. Okay. If you want to know the brand I use, reach out. I am happy to help you. Okay. I will plug this brand all day long. I love it. Okay. But just know that quality sleep is great. But whenever I'm telling you about pajamas, I'm being very, very serious here when I'm saying that wear what you're comfortable in. If you're wearing what you came into this world with, and that is your way of falling asleep, do it. Okay? Even if you need the fan on, I totally understand. Or if you're someone who's like, nope, I have to have a muumuu, or if you feel like if you wore a muumuu and you would get twisted up and you would wake up wondering if you were in a mummy sack, then don't go to sleep in a muumuu, okay? Go to sleep in what is absolutely comfortable. Y'all, you are grown. Get the good sheets. Get the good bedding. Get the good thread count, okay? This is just your public service announcement to get yourself a nice set of sheets. Get you a couple of them because when one's in the wash, you're going to want to change them out, okay? Because really, truthfully, honestly, poor sleep can increase ghrelin, which is like those hunger hormones, Why in the world do you think people get up in the morning, like 3 o'clock in the morning, and they go into the kitchen and eat a snack, right? We really don't want that unnecessarily increase in that ghrelin, that hunger hormone, because when we're asleep, we want our we want our blood sugars to stabilize. Yes, that is super important that when we're asleep to really have our body to be able to be like, okay, she's asleep. We're going to go ahead and get started because your body is like 24/7 go, go, go. But when you're in that state of rest, you've got this muscle recovery, you've got your insulin that is, your blood sugars are doing their maintenance, what they're supposed to be doing. If you wake up and you feel like you have low blood sugar, get with your provider and let's talk about if protein snack before bedtime is perfect for you. All right. So in decreased leptin, okay, that satiety hormone, okay, we need some good quality sleep. Okay, and so I'm going to say it again. We need a good quality sleep because poor sleep can increase ghrelin, which is that hunger hormone, and decrease leptin, which is that satiety hormone. We do not want to be bumping around and messing around with our body's natural chemistry, okay, if we can help it. So that doesn't mean there won't be fluctuations or that every day will be easy. It's not. But remember, we're trying things out, okay? But it does mean that you have agency, okay? There, many women have successfully lost or maintained weight in perimenopause, literally by combining movement, nutrition, and stress support, okay? So if you want to get on a GLP-1 and you want to talk to your practitioner or you want to talk to me about a natural GLP-1, let's have that conversation, okay? But really, stop telling yourself it's inevitable, okay? Instead, ask, like, what small change can you make today to feel stronger, healthier, more empowered in your own body, right? So those were four of the biggest myths. Yeah, those were pretty heavy, right? So let's talk about how to like reframe your mindset so that you can actually move forward, okay? So, myth one, you're too young. The truth, perimenopause can start in your late 30s, okay? Here's going to be those action steps, okay? Track your cycle, okay? Length and symptoms every single month. If you see a pattern of shorter or irregular cycles, okay, make sure you schedule labs with your provider to get an FSH, LH, estradiol. Make sure you get that, okay? Myth number two, just tough it out. The truth is that symptoms are signals. Your body is asking you for support, okay? Here's the action step. Implement one self-care ritual today, like 5 minutes of deep diaphragmatic breathing before bed. Swap your evening latte for a caffeine-free, magnesium-infused herbal tea, okay? Or add a short evening walk to clear the cortisol and really improve that sleep, okay? I'm not talking bust out the weights, the ankle weights, and the little tiny 1 pound weights like I talk about during the day. This is literally, we are just going for the mind clearing walk. Okay. Myth number three, hormone therapy is dangerous. The truth is, bioidentical hormone therapy, when used responsibly, can be life changing for many women. Okay. Here's the action step. If you have persistent, debilitating symptoms, consider a low dose estrogen, transdermal, like estrogen plus a bioidentical progesterone protocol, okay, with lab monitoring every 3 to 6 months. Talk with a practitioner who specializes in women's hormonal health, or make sure you book an appointment with me if we've already talked about it, okay? All right, here's myth number four. Weight gain is inevitable. The truth is, you can reshape your body with targeted nutrition, strength training, and stress and support, like that stress sleep support. Does that make sense? And also, if you're wanting to start a GLP-1, let's have a conversation. Okay? But the action step really is plan 2 30-minute strength training workouts this week. We're talking physician permitted, right? Prioritize protein at each meal, like aiming for a palm-sized serving. Like I said, make sure you get with your provider to see if protein is right for you. And schedule those no tech times, like 30 minutes before bed, to really improve that quality of sleep. Because we talked about it. We already know that sometimes TikTok or Facebook is going to just literally send us down a rabbit hole. We're going to be stressed out, and we were worse off before we even got on there. Okay? So, now, every myth we debunk is a step to, it's totally a step towards empowerment. I think that's so important because knowledge isn't power, it's applied knowledge is power. Okay? So I just want to share a quick story, and we're going to call her Sarah. We love a good story. Okay? Sarah, she was 42 when she came to me. She was convinced she was too young for this. She'd been feeling exhausted. Her periods were erratic. She'd gained like 15 pounds without changing her diet. And she was anxious about her future. So we started by tracking her cycle and symptoms for 2 months. She realized her sleep was absolutely awful after 2 a.m. So we tweaked her evening routine. No screens after 8 p.m. So a magnesium, like melatonin blend, there's also, remember I know that there's also a non-melatonin blend, but for her, it was a magnesium melatonin blend. And I told her, like, let's do some gentle stretching. So she added 2 weekly strength sessions, just 20 minutes each. And then she increased her protein intake to 25 grams at each meal. And so, like, that alone improved her weight, her sleep, and her mood. Yeah, everybody's happy in the house, right? So then we ran labs. We discovered her estradiol was low, and her progesterone was borderline, and her DHEAS, it was low. So we added a low dose bioidentical transdermal estrogen patch, micronized progesterone at night, and a DHEA supplement. Okay, this was her story. Okay, within 6 weeks, her hot flashes decreased by 80%, her brain fog lifted, and she lost 10 pounds without dieting. So there you go. So that's literally the power of challenging myths and taking like that informed action. So as a nurse, I'm here to guide you through these transitions, both with clinical knowledge and really like compassionate support. So if you're thinking, I want Sarah's results, well, I would love to work with you too. And just so you know, I do collaborate with practitioners. I really make sure that if what I'm doing, I'm not doing what they're doing because we're in, 2 different things. But I make sure that clients tell their practitioner like what we're doing, and if there's something that the physician needs to prescribe, or we would love to have a conversation to see if the physician would be amenable, agreeable to prescribing it as part of this patient's care so we can, do this thing. It's such a wonderful, great thing when we can get together. Okay. So you can book a one-on-one consultation with me. The link is going to be in the show notes. If you can't find it, it's also on my website. It's the same name as this, this podcast, Self-Care University. Okay. Just add the .com. And we can review your labs, talk about your symptoms, those goals, and actually build a personalized plan, okay? So you can also join the Women's Wellness Journey. It's my membership group where we dive deep into monthly hormone education. I do monthly live Q&A, and you also have a private support community. Literally, you also have a ton of curated resources at your disposal. The other thing that you can do if you're like, I don't know, if by now you're just like, I don't know, I'm still on the fence. All right. Sign up for the email list. That is so important. You can also send me an email to let me know that you would love to be on my email list. You'll get weekly tips. You'll get some PDFs that are going to be super great that you're actually going to want to use. You get freebies to help you with everyday things to just kind of help you along your way. All right. So, and just remember, before we wrap up, I want to remind you, you deserve to feel vibrant, like physically, mentally, and emotionally. I told y'all this was going to be, this is deep, right? So, perimenopause and menopause, those are not punishments. They're actually natural life stages. Let's go. Let's rock them, okay? Let's have a good time. Let's make menopause fun. And information and support, those are your allies, okay? Seek out qualified professionals and communities that lift you up. So, if at any point you feel lost or overwhelmed, please know that you're not alone, okay? There's a whole community of women going through this same journey, right? Or similar. So, my Women's Wellness Journey is one place to find a really good sisterhood, guidance, and what's most important is science-backed strategies. Okay? So really, let's trade myths for empowerment together. So, if this episode resonated, please share it with a friend who might need to hear these truths. Okay? Make sure you hit the follow, subscribe on this account, and make sure you don't miss an episode because there's so much more to go, right? And if you're ready to get, like dive in, dig deeper, you can book a call, you can join the membership, sign up for my email list. All the links are in the show notes or they're also in my website. So, and I really thank you for trusting me as your guide. So, I'm Connie Street. I'm an RN, and this is Self Care University OK, where healing, hormones, and harmony meet. Until next time, be kind to yourself, keep asking questions, and remember, myths only hold power if you let them.